Okay, looking at doing a Sperling's test. You're gonna have the patient. You're gonna come to the patient here. You're gonna have the patient rotate, or I'm sorry, side bend about 20 to 30 degrees. You can come to their side. You're gonna hook your arm around them like this. You're gonna have your other head stabilizing as well, and you're just. Are you having any symptoms in this position, Nathan?
No.
Okay. And then you're going to push down approximately 7 to 10 pounds of force. Any symptoms with that?
Nope.
Okay. And then for the quadrant test, I'll have Nathan look up that direction. I'll kind of position him a little bit more extension here. Kind of the same hand placement. And are you having any symptoms in this position here?
Nope.
Push down with about the same amount of force, maybe a little bit less than the Sperlings. Come on up. Any pain with that? So, if there was to be a positive test, that tells me there's probably some radiculopathy there. Negative test, you might go through some more tests, but that's leading you away from radiculopathy there. In the you go and lay on your back. In supine, we're going to do some passive distraction. This should feel good to the patient. If they're having those symptoms shooting down the arm, hopefully this will reduce those symptoms, or maybe they won't go as far. So you'll have one hand underneath the patient's head over here. Other hand you're going to put right under the chin. And you're going to position yourself here so you're kind of in that baseball stance. And you're going to do about 60% from your bottom hand and 40% from your top hand, and just lean back. And then, did you have any pain or symptom really from
Nope.
that? Okay. You also didn't have any pain to start with, so that wouldn't really tell us much, but if they had their symptoms reduced from that, that would tell us it's probably coming from the spinal cord there. And then we'll do stretching of the upper traps. So what I'll have Nathan do is I'm going to stretch the upper trap on this side. I'll have him go away. I'll have him flex a little bit, and then I'll rotate his head towards it. And then I'll put my hand on the shoulder right here next to the trap I'm stretching, push down, and then I'll just rest his head right here on my stomach here, and just have him push into that stretch. How's that?
Good.
Okay. For the levator, same sort of setup, but you're going to have the patient put his nose toward his opposite armpit. So you go ahead and do that. And then same sort of idea with this hand and with your stomach, and just push until you feel that stretch. And then for the scalene stretch, it's going to be just like the upper trap, but you're going to have the patient's head into a little bit of extension. So if I'm stretching this right side, side bend away, rotate toward, do a little bit of extension. And once again, you can push with this hand right into that shoulder. Okay. There was one more. And then I'll have you go on your stomach, hitting your UPAs. Here, you can come around on this side of it. You want, be on this side of the patient here. You want your hands like this in a V shape, and they're not going to come away from this position. You're going to pull up the slack with your forefingers here, and then you're going to push down through your thumbs, one on top of the other, and you're going to push down with some protraction of your shoulder. So there's no motion actually coming from the elbows or the wrists or the fingers. It's all from protraction. So I can come around this side on Nathan, find some of his processes here, the spinous processes, come off of that a little bit, form my V, pull up the slack, and then I can push down, and then I can go down each level, and then that will create some rotation to the opposite side. And then you can go ahead and do it on the other side too. Opening will create some relief if there's some pinching, and then if you're going towards the side that's closing, that will help with mobility. And if there's any that feel like they're not moving as far, those are hypomobile, meaning that there is some sort of tension, whether it's from the muscle or if the joint itself just isn't moving very well. If it's hypermobile, that means there's some joint laxity there. And then obviously normal is normal, you don't have to do anything with that.